everybody. I'm on here today to present yet another incredible item that we've just added to the Go-To Coders product line. So a study guide is only as good as its practice cases and as good as its answer key explanations. Once again, MCA breaks the mold and takes a true superhero approach in order to rescue the people who are preparing to take the national certification exam, and or also those people who are struggling or having a hard time passing it. Basically, if you fit either of those categories, get this jaw-dropping kit. Okay, I'm going to show it to you in a second. If you studied a while back and desperately need a refresher, get this out of the world kit. The teachings that have been transported into this prep kit, study type of adventure, are, for lack of a better word, invaluable. The kit itself is just mesmerizing. Look at this little beauty. See? All its glory right here. But inside this little gem, you're going to encounter basically the 4 critical steps that you need that are needed in order to fully prepare you for the certification test. The first thing that you're going to pull out is this handy dandy flyer. It's a flyer that, please do not throw it away. It says at the very top, never throw this page away. Don't do that because it's got all the instructions on how to be guided on exactly how to get through all the steps within the kit. So really, really important there. But once you get past the instructions, again, front and back, I want you to move on to basically step number 1. So let me present that to you. So for step number 1, that is your Go-To Coders tabbing system. It's going to come sealed like this because it's got tabs inside. And I'm not going to open it because I want you to, you're better off watching the video that's called Medical Coding Academy, How to Tab Your Books. And that way you'll see all the contents, and you can even see me tabbing my books. But definitely check that out. So spend the time doing or placing the 192 tabs all throughout your CPT book, your ICD-10 book, and your HCPCS HCPCS book. And by the way, if anybody needs books, if you haven't ordered your CPT, ICD-10, or HCPCS, we do contract with a publisher that gets you a really good deal on all 3 of those books. So if you want to go that route, send us an email and we'll be happy to send you the link where you can buy all 3 books at a bundle price. And you'll love them. They're beautiful. The books I'm talking about, the coding books, are absolutely beautiful. Okay, so once you get past step number 1, the next step I have for you is the color coding chart. This little guy right here. Hope you can see it okay. So this is the color. So you know what? This is the part where you will basically mark up your books. Have you ever wished someone would just spoon feed you the words in which you need to look for in a case? Well, your wish is my command, because that's what this is. In this step, you're going to learn basically the exam blasting, color coding, highlighting techniques. And when you highlight certain words in certain codes, it's basically gonna emphasize those critical key words that really, really need to jump out at you when time is of the essence. Also, to clarify, the only 2 products that offer the color coding chart is our online program and then the exam prep kit, this one right here. Both color coding charts offer the same exact board exam preparation, but that stated, there is some bonus real world information that's found in the color coding chart from the online course that's not found here. But either way, both of them are identical when it comes to exam prep. So I get a kick out of making things really simple for people. To that end, here's what I do. This right here, my lovelies, is step number 3. The 150 study cases or coding cases, same thing. Look at this captivating little gem. Like everything else MCA, all detailed rationales come in strategic, to the point, easy to read format. Fully comprehending and understanding the guidelines are essential to passing the test. So the book itself is easy to navigate. To that end, let me tell you about the bells and whistles about this book. First thing I want to point out is that we placed it on a coil, all right? It's not going to slam shut on you just because you take your hands off of it and you turn around, it's shut. That's not going to happen. The next thing I wanted to show you was that the pages inside are colorful, okay? You're not going to be bored. Pretty darn refreshing. It's just got this theme all across it that makes the book look very inviting and very refreshing. I love the refreshing appeal to it. Let me find, there you go. Like, here's a perfect example, just like this. I hope you can see that okay. But moving on, my absolute favorite thing is the fact that every single answer key is placed directly behind each case, which tells you one case per page, and right behind it is the answer. There is no such thing as cramming all kinds of things into this book. Literally, I've seen all the study guides in the industry, and every single publisher company crams as many questions or cases that they can per page and as many answer keys per page. That's not what we do. All right. Once again, we care about the learner's comfort and convenience. No cramming of any sort. NCA cares deeply about your learning, but we also care about your comfort and your convenience. All right. So I just think that it's important. I want my learners to feel spoiled. Give them, my very, very best, basically. Out of sheer gratitude that I feel that they believe in MCA products. So anyway, you all deserve the best. Everything is printed on highest quality type of paper. Very difficult to tear the pages, and definitely won't be bleeding through. So highlight all you want. The answer keys are very comprehensive and also very color coded, jam packed with detailed explanations of the ICD-10 CPT medical coding guidelines. The content knowledge within the book, includes that of ICD-10 CM guidelines, CPT guidelines, HCPCS, evaluation and management, anesthesia, radiology, pathology, path and lab, medicine, and then when it comes to surgery, the musculoskeletal system, the integumentary system, the respiratory, the cardiology, cardiovascular, the digestive, the urinary, the male, the female, the nervous system, the eye system, and I think I left something out. I don't remember, but that's all the content in here. You're going to learn how to code everything. Absolutely everything. We skimped out on nothing. Beyond that, and moving on, the guide also includes some pretty vital non-coding type of learning that often pop up on certification exams as well. Things like medical terminology, anatomy, medical abbreviations, compliance, Medicare, topics like that. If passing the test was all that mattered, I literally would have ended that book right there. But the fact of the matter is, once you pass your certification exam, you're going to need to perform in the real world. For this reason, I wanted to explain that basically there's a skill set needed to pass the certification exam, but there's also a skill set needed to perform in the real world. And there is a significant gap that lies between the test and the real world. And this guide closes that gap. Because after equipping you with the skills to pass the certification test, I'm then going to move you into the real world aspect of the book and of the field. All right, so this is where the learner is going to learn how to abstract the key words from every single case. Because that's the only way they're going to master knowing what and how to abstract and enter what they abstract into their encoder software at work. So definitely, this is where the skill set of deciphering the correct diagnosis and procedures in each and every case is going to be vastly developed. But then, after completing all of the what I call encoder exercises, the abstracting, I'm now going to move the learner and teach them how to code those very same diagnosis and procedures using the intricate alphabetical indexes of your code books. That CPT alphabetical index, that ICD-10 alphabetical index, and the same thing with HCPCS. So I mean, hands down, there is no other creation that combines exam prep and real world learning at the same exact time. I've seen them all, guys, okay? I've had them all. So I hope you can see that by now. The bottom line is that Medical Coding Academy considered the learner in every literal single thing that we did. Each lesson is taught, of course, with a heart of compassion, and you're going to feel a sense of servanthood out of the book. So moving on to step number 4, that's the mock exam. You know, it is so amazing to be able to finish the coding cases and carry that incredible momentum right onto the mock exam. All right. But before I show you that, I'm hesitating because I want to first show you this, okay? Enclosed with the exam is a Scantron. On the back of the Scantron, this is the Scantron side. On the back is the instructions, and I pulled that out first because it's very important that you read and you are guided by these instructions before opening the mock exam that's inside. Do not open the mock exam before time. It's very important that you don't peek at any questions. Okay, so and again, the mock exam, excuse me, the Scantron and the mock exam will be sealed together so that the only thing that you can see is this side of the Scantron, and you won't be able to see or peek inside your mock exam until the time comes. All right, now let me show you the mock exam. So here we go. There we go. There it is, see? And so once again, coil. All right, we put the mock exam on a coil because those things matter to us. All right, now listen. Besides the coil, inside the mock exam, the same type of setup continues where it's colors. We use colors now. We used a whole lot less colors because we wanted to mimic the exam as much as possible. But also very refreshing look. Sometimes a little boring, but only because, again, we were trying to mimic the real exam in this case. So minimal color used in terms of the cases themselves. But once you get into the answer key portion, then you're going to start to see the colors come back. And you're going to be very used to those color-coded type of answer keys, you know, having kept the same type of answer key type of format from the study cases. All right, but there you go. Now I want to show you something about this. So once again, the Scantron side of it and the instructions. Okay. Also on the back of the Scantron, you're going to see some pretty amazing exam tips and how to grade and score your Scantron, etc. It'll also tell you how to calculate your score. Point is, get ready to achieve stellar results. Okay, so once again, with the mock exam, we still kept it on a coil. The pages inside are still with color, and then we kept the same learning formats, the same type of comprehensive, detailed answer keys, yet still straight to the point. The only thing that I want to point out with the answer keys is that I couldn't put them directly behind each case, because then the tester would end up accidentally seeing the answer. So I couldn't do that. So I had to place the answers at the back this time. But don't worry, because each key still has its own page. So again, one entire page for an answer key. All right, we did not cram anything, even at the end. And also, a neat little partner for the kit is this little baby. All right, this is the Flipbook Treasures. They're so amazing. So I want you to make sure you watch that video. I have it out on Medical Coding Academy YouTube as well. So catch that video and check those out. A lot of people are just falling in love with them. I mean, they're truly, they're invaluable. Okay, what the information that are inside these, invaluable. I mean, really, just as invaluable as the prep kit. But yeah, so be sure and check that video out. Also, be sure and check out the video on the tabbing system in case you have a hard time knowing how to tab. And if by chance you feel like you only need one or two of the items in the prep kit, then visit the website, the medicalcodingacademy.org website, so that you can buy products that are or independent products that we have listed on there. So, you cannot put a price on experiencing what the real test is going to be like simply by having a dry run simulation of the mock exam. All right. The mock exam is going to be detailed yet to the point type of rationales that are going to reveal which questions you missed, and more importantly, why you missed it. There will be no repeating of the same mistakes. This experience, minimizes, if not completely eliminates, being caught off guard when you take the actual test. It's amazing. It's almost like this is your first try and then the real exam is your second try. It's amazing. I also want to mention that you guys make sure that you're guided by every word for word instruction that is located not just on the flyer that I showed you earlier, but also in the first few pages of every single book. All right. Sometimes they're printed on the kit. That reminds me, I want you all to know that we have a lot of products out right now at this time this stage in the game. And I want you all to know that Medical Coding Academy doesn't overlap anything. So when you buy the online course and you get all those products, those cases, those mock exams, they're nothing like, what I'm presenting here or what I'm presenting in the future ever. Nothing will ever. So basically, if there's a different cover, all the cases, all the information inside are different. All right. We did that, of course, because, we knew you would want extra practice. And then we did that because, if we put the same exact cases in different books, then you'd end up as a consumer, buying something that you already catch that. We do offer an online course too. It has its own products. So just check everything out on the website and make your best decision. You know yourself, you know what's best for you. Be sure and read all the testimonials, all the reviews located all throughout our social media, because once you do that, it's a done deal. These are testimonies coming from people just like you. So anyway, please don't piddle around with buying all kinds of resources from all kinds of companies. Save yourselves the time, the money, the heartache, the frustration, because nothing out there is going to provide a fair apples to apples comparison. Follow us on Instagram, on Facebook, on LinkedIn, and Twitter. Thank you so much for watching, and I had a blast showing you everything. I'm sorry that it was kind of difficult to show you everything, but just know that you're gonna love it. You're going to love it. There's no way not. You're gonna love it because I did it with all of my heart. God bless you all.